this is Finley. He's come in because the owner suspects a foreign body, so we're going to x-ray him just to see if he has ingested anything. So firstly, I've turned the machine on the wall here to the on position, and I've also turned it on here for our x-ray machine. And then we'll just come over here and input details onto the computer. So we've got patient ID, patient name, sex, date of birth, and then we're going to press OK. And we're then going to select which part of the body we're doing. So we're going to select dog body, and we're going to do lateral abdomen and VD abdomen. Select OK, and that will bring us here. So then we're going to, I've selected the small plate, which I've popped on the table, and we're also going to use a calabash to measure across the abdomen, like so. So little Finley's measuring about 3 to 4 centimetres. So then we're going to come over to, and we're going to select which part of the body we're doing and input the centimetres. So we'll just change that. Now this machine automatically sets our kV, mass and time. If we need to double check, we can use our exposure chart, which also tells us that we're not going to be using the grid today. So I've placed our cassette on top of the table, and then I'm going to turn on the light so we can collimate. So I'm going to put the right side down. I'm also going to use our label to mark that we're doing the right side. And we use these dials to select the part of the body that we want to focus on, like so. And that is the setting up of the machine and positioning and collimating our patient. Okay, so just before we take our x-ray, our patient is sedated and being monitored. We're going to use some leg ties or a sandbag to position and hold the patient how we want them to. So we'll just pop our light on, and now we're going to, so they're all positioned and we're going to take our x-ray. So what we'll do is close this door, stand behind the door and use our little button, half press, wait for the machine to beep, and then fully press. And then after it's been taken, we're going to take our cassette, pop it into the machine, wait for it to read, and then it will bring up our image here. So as you can see, there are 2 little foreign bodies pin tucks in our patient, in the gastrointestinal system. With this image, we can't see our left and right side marker, so that's something that needs to be popped on there. It could also be collimated as well, just because we've got some tail and some blank space in there as well.